Thank you for joining me today. This is the Bold Lines Podcast, and I am your host, Travis Thompson. Today, we're going to be talking about the three different origins of mental health issues. Today's episode comes from some reflection that I've done on myself and the years that I've been practicing. I've heard many times over that someone has some sort of disorder or diagnosis. And while that can be helpful, it doesn't always tell the full story or why someone has that diagnosis. Now, it might be sounding like I'm splitting hairs right now, but parsing out the difference between a true diagnosis and something that someone is just internalizing is incredibly important. I'm going to be, I almost said straightforward today, but then I realized that almost every episode is really straightforward, that I'm going to be a little more direct to help make sense of things. What I will say is not to disparage anyone or have them reflect on their sense of self, but to help people critique their own point of view on mental health and where it comes from. So the three different origins of mental health, I'll give them to you and then we'll dive into each one of them. So the first origin of mental health issues comes from a wiring problem. This is where the brain simply doesn't have the right neurochemicals it needs to make sound decision. A lot of this is just genetics, although some of it can be in utero or because of a stroke or some other traumatic biological event. The second origin of mental health issues comes from trauma that someone has experienced or the beliefs that they have taken on. The last category of mental health issues comes from when we do dumb things. Now, I've hopefully titillated your ears enough to be interested in what comes next. So, let me start by saying that mental health disorders are not as clear-cut as they may sound in popular media or in research. At this point in the podcast, if you've listened to all of the episodes, you've come to understand that I'm critical of how we see mental health as a culture. Not in a sense that I think mental health is stupid. I mean, I'm a therapist. But I'd rather see it as a descriptor rather than a label someone wears. And today's episode is about us being curious about where those descriptions come from. All kinds of mental disorders exist, and within these three categories I've given you, there can certainly be some crossover, but that crossover is often misunderstood. I would argue if you can organize your own mental health into one of these three categories or see the overlap between them, you would be able to effectively address your own mental health outside of what has seemed like endless work or meaningless gestures you've taken. So let's start with the first category, wiring issues in our brain. I've spoken about these in previous episodes, especially last week when I talked about schizophrenia, or seeing, hearing, feeling things that aren't there. Another diagnosis in this category is autism. It's a wiring issue. It's where the brain is missing something. There's some kind of disconnection. And there's nothing that anyone can do to change that wiring. Now, some people will assume that all of their mental health disorders are wiring issues, and I'll just flat out tell you, I don't think that's the truth. I cannot see any good reason why all mental health disorders would be a purely neurological problem. Now, do we see the neurological effects of mental health issues, beliefs, and trauma? Absolutely we do. But simply seeing the effect of a mental health disorder does not in itself identify that it's a brain issue. So, what do we do with wiring issues? We have to recognize that wiring issues cannot be inherently changed, but they can be adapted to and treated. So what does that mean? If someone has autism, for instance, they can't make themselves what we would call neurotypical. But what they can do is learn skills and relationships and push themselves in all different kinds of therapy to become more functional and feel more comfortable in themselves. They can also get treatment with some of the common disorders that follow along with autism, things like attention deficit disorder or obsessive compulsive disorder. Those are things that we treat because it's a reality of how someone's wired. I'll go ahead and acknowledge that things like schizophrenia and autism are broad brushstrokes. Autism has become so expanded that we just call it a spectrum disorder now. And schizophrenia, if psychologists are being honest, is quite the umbrella term. We don't know exactly where in the brain it comes from, and there's a suspicion that it could come from multiple places. But for the sake of this podcast, let's just all assume that it's the same thing. For things that are wiring issues, the most obvious being things like schizophrenia and autism, so we use medication and skills for. It's not a mark of someone's character that they have a wiring issue. What they do with it certainly can be, but just having the issue itself doesn't say much about a person. When those people decide to get treatment or others see the need for it and encourage them to do so, it should be a grueling experience. Not because someone should suffer, but that's just the reality. It's long-term work to address wiring issues because sometimes they might see the world differently than other people see it, and it takes time for things to make sense. So what about those other wiring issues that need actual medication or direct treatment? I would argue for some people, things like anxiety and depression can be wiring issues. But hear me now, I'm going to explain this a little bit later. They are not always. I would agree that for some people, they either get an overabundance of neurochemicals or they get very little of them. That has nothing to do with what they're doing. It has nothing to do with drugs they're taking or how they treat people. Don't mistake the wiring issues of possible anxiety and depression with trauma or beliefs that someone has or because they're doing dumb things, although all of that can certainly overlap. There are many things in the human body that we just consider facts of life. Whether it's hair color, whether it's height, being double jointed even. All of those things are just realities. They don't make a person. They're simply who they are. But let's say that it's more than just little quirks that people have. Let's say that someone has something like cerebral palsy. They develop this inability to walk or function on their own. Does that have anything to say about their character, or is it simply something they experience? For the true mental health disorders that are under this category of wiring issues, I would treat them much the same. You do what you can. You empathize with people. You put it on them to follow through on the treatment that is within their power. And then you adapt and move on. The second category that I spoke about are traumas and beliefs that have brought upon mental health issues. These can sometimes be misconstrued as wiring issues. Let me give you an example. Someone can tell me that they were just born angry, which doesn't happen. I'm just going to level with you. There's a lot of things that people tell me that say that they were born that way, and it's just not the case. What they really should say is, for as long as I can remember, I've been this way. And for a lot of issues that people come into therapy for, it's trauma or the beliefs that they've developed over time. The easiest example of this is post-traumatic stress disorder. Those flashbacks or the heightened sense of awareness, the stress or the inability to feel calm. People aren't born with PTSD. They experience PTSD because of the things that have happened to them and the beliefs and the protective measures that they've developed over time. So that has to be different than a wiring issue. It can't just be, oh, well, sorry, you're born that way. Here's where it gets complicated, though. You can get an anxiety disorder from trauma or beliefs. Well, what do we do with that? Because I just said before that people can be born with a wiring issue. Yeah, that's where good therapy comes in. I hope you were on a cliffhanger there for a second, because it's honestly a lot of the work that I do. These traumas and beliefs come from things that have happened to you. Sometimes it's an event, or sometimes it's something we've come to understand. Let me give you an example. I work with many clients who, going through their past family history, will recount beliefs of feeling small and insignificant. If I were to go ask their parents if they ever told them they were small and insignificant, they would be mortified because they never would have said anything like that to their child. The problem is, it isn't exactly what happened to the child, but the beliefs that they developed because of it. Those beliefs, directly or indirectly influenced, absolutely can bring on mental health issues. So were they born with it? Or is it just something they've experienced for as long as they can remember? This second category is what most people experience. They've come to assume that the mental health issues that they struggle with are because there's something inherently flawed or wrong with them, when in reality, it comes from trauma or beliefs that people have developed over time. The last category, and quite honestly, the funniest one for me personally to deal with in therapy, is because sometimes we do dumb things. Look, if I have someone come into my office and say, I think I have anxiety, okay, my first question after that is, well, why do you think that? And let's just imagine in this fanciful scenario that I have a client who tells me that every time they're around their wife, they feel anxious. Now, we could sit and wonder, man, I wonder if your mother treated you badly. And you've internalized that experience with women, or maybe you had a harsh breakup, or maybe there's some deeper fear or something that you know that you're unable to share. Maybe all of that could be true. Or you could be cheating on her. That might sound a little harsh, but it's very realistic. I really hope that people stop for a second and might realize that some of their mental health disorders or their mental health issues are because they're doing dumb things. If I had a client who came up and told me they have an anxiety disorder, and come to find out it's because they're actively cheating on their wife, I'm not giving you any kind of recommendation for medication. I'm not going to give you therapy to help soothe your anxiety around your wife. I'm going to tell you to stop cheating on your wife. Stop doing dumb things. And those mental health issues might disappear. Sometimes people come into therapy and they say, I feel inadequate. I feel unable to address the needs in my life. Follow-up question, why do you feel that way? We get into some of the deeper details and come to find out they don't do anything active or productive in their life. I'm not entirely sure what someone would want me to do as a therapist if they're not doing anything active in their lives. They're not talking to people. They're not chasing dreams. They're not interacting with family. What is it that you want me to do as a therapist? I can't help you if you're doing dumb things. If we take that a little more extreme, let's say someone is using drugs, and let's just take it on the lighter side here and say someone has active marijuana use. And they come to me and say, well, I have these bouts of anxiety. Sure. When do they happen? Oh, when I smoke. I get real paranoid. Dude, stop smoking weed, and you might not have anxiety and panic attacks. you might have this mental health issue because you're doing dumb things. For this category of mental health issues, and I say that very sarcastically, this is where I tell clients to grow up. Again, if you missed the beginning of this episode, where I warned you I'd be more straightforward than where I usually am, yeah, if someone has a mental health issue that is entirely under their control, I'm going to ask them to stop doing dumb things. Now, look, are there underlying motivations why someone might be smoking weed? Sure. Maybe they have experienced trauma and smoking is a way to help them alleviate stress. That's fine. 100% on board with that. I will absolutely be empathetic. However, it's not going to help your panic attacks if you keep smoking. That one's on you. There's a balance in this. I'm not going to berate a client for their bad decisions, although I refuse to treat my clients as anything but competent adults. So, if you want your circumstances to be different, at least in my office, it's up to you. I've given you these 3 categories of mental health issues. People who have wiring issues, they have trauma or beliefs they've developed, and because sometimes they do dumb things. What do we do with this? How do these interact or connect with one another? Let's talk about anxiety and how it intersects with all of these. That seems to be the easiest one for most people to talk about and seemingly wear as a badge. So let's imagine that Billy here has a neurological wiring issue of anxiety. Something in his brain just isn't right. And no matter what he has done in the past, the anxiety doesn't go away. Okay, so we have a wiring issue. Now, let's add on top of that he's had a chaotic family life. Okay, that's certainly traumatic, and that certainly develops beliefs. But what if Billy also skips school and decides to take his chances? Maybe truancy isn't a big deal to him, and the anxiety he feels around school is in part because he keeps skipping class. So which one is it for little Billy? Is it a wiring issue? Is it trauma or beliefs? Or is it because he's doing dumb things? Yes. Effective intervention in therapy should address all of them. In my opinion, we should work our way back. The first thing I'd tell Billy to do is stop doing dumb things. Let's see how the anxiety changes. Not in the sense of, I want someone to act into right thinking and be good enough to come to therapy. It's not that at all. This is problem solving. This is triage. Great, so we get Billy to stop doing dumb things, and lo and behold, he's doing dumb things to help cope with the stress that he's feeling at home. Well, we've gotten Billy to stop doing dumb things by being straightforward and telling him to grow up, but he comes into my office with trauma, real trauma, things that he has a hard time admitting to himself and saying to another person. That's where therapy comes in. And that's honestly where I think most therapy should sit in, the trauma and the beliefs that we've developed over time. And with Billy, I'd sit and work through the family of origin stuff, how he understands himself and what makes him tick. But let's say from some miracle, we were able to work through all of those things, and he feels a full resolution, which honestly, look, it doesn't work that way, but let's just imagine it is. Then we get to the wiring issue. At that point, I'd ask him to find coping skills, and if that's not enough, take a little bit of medication and move on with his life. The fear in all of this stuff for me is that as a therapist and almost doctor, it seems as if when people talk about diagnoses, they lump all of these categories together as if they're the same thing. And they're just not. I can't tell you how many times I read an article or I see a news report or I talk to a client or a colleague and they talk about some sort of diagnosis as if it's this set in stone thing. I'm guaranteeing you it's way more complicated than that. If someone was born with something like schizophrenia, it doesn't mean the rest of their life is meaningless. It doesn't mean that trauma or beliefs aren't going to develop or they won't do dumb things. When it comes to intervention, we have to step away from this nonsense that you have this label, deal with it. We need to know where it comes from. God forbid we start treating people as if they have a wiring issue when in the reality they're doing dumb things. And we've just cemented something in them that's not really true. And if I'm being honest, a lot of the stuff that we're seeing in media and mental health nowadays, I think is that. Do people have traumatic beliefs? Do people have trauma in their past? Sure. But then you start to ask what they do with their lives. You get curious about what they do and you find out they're on the internet all day. They don't form meaningful relationships. They aren't challenged in any way. Yeah, you don't have anxiety. You don't have these considerable disorders because of how someone treated you. I would argue a lot of it was grown and festered in doing dumb things and not taking care of yourself. I've seen this as I've worked in facilities where I had to deal with clients and patients who came to me and would use the threat of a wiring issue or trauma they've experienced when in reality it's because they're doing something dumb. Eventually I got tired of it and I just started calling it as it was, and lo and behold, some things started changing. Now, none of this is a bludgeon to go tell those that you care about, or frankly, those that you don't care about, that their mental health issues are pointless. It's because they're being an idiot. Although for some people, that might do the trick. Here's the thing, though. We have to be curious about mental health. Let's pull it out of just the diagnostic criteria and start seeing people as human. If I treat people as whole human beings, and I refuse to treat clients as anything less than that, I'm going to call them to the table for the dumb things that they do. If I have a client whose life feels meaningless, come to find out they don't leave their room all day, they don't have a job, and they don't form meaningful relationships, I don't know what I could do to help this person make sense of things other than placate them and tell them they're perfect the way that they are. And I just refuse to do that. Once we do break that down and they can go be a productive member of society, chances are all of those beliefs that were driving that behavior start to pop up. And congratulations, we've moved from accountability to therapy. That's what I do. You call people to the table for the things that they are 100% accountable for. Once they've accepted that, and once they can engage in that, when you can go back and look through someone's history and correctly call them to the table and be accurate about the things that they really can control, then you can move into meaningful work. This is what I've seen be so effective with a lot of my clients is I call them to accountability, not because I think they're stupid, but because I think they're grown, because I think they're competent and they can make their own decisions. If you're seeing this in yourself, I hope there's some element of conviction. I hope that maybe you've recognized something in yourself, that maybe some of the issues that you're facing are because of the behaviors you're enacting. Maybe if you stop doing dumb things, you might experience less pain. Sounds harsh. Quite honestly, it's the truth. Maybe you have taken accountability and you've done as much as you can to make sense of the world. And still, there's trauma. There's these deeply held beliefs. Please go speak to someone. This is where I thrive. This is where I love to sit with clients. I don't revel in when they feel pain, but I feel honored to be a part of the healing. And if you've done all of that work and there's still a wiring issue, I would say there's no shame in treating it that way. If something's a wiring issue, it's not an aspect of your character. It's just something you deal with. If you want to bring all of this together, here's what I would give for you to do. Take these three categories: a wiring issue, traumas and beliefs, and because we do dumb things. And assess whatever mental health issue you have in front of you and put a percentage on each category. How much of what you experience that is negative in your life is because you're doing dumb things? What percentage is because of the traumas or beliefs that you have? And how much of it is because of a wiring issue? And if you've written this down or at least thought about it in your mind, those percentages should be how much effort you put forth on getting healing. If 50% of your problem is because you do dumb things, 50% of your effort and change should be in accountability. If 20% is in the trauma and beliefs, 20% of your work should be in therapy and working through things. And if the remaining 30% is a wiring issue, then you could use therapy on skills and how to make sense of the world and finding medication that would help. I hope from today you've gotten a clearer understanding of diagnosis and mental health issues and can put it in the perspective of humanity and how we experience the world and not just what we would see in an overtly clinical setting. If today has been helpful for you, please feel free to leave a tip in the tip jar so I can pay the producer. Otherwise, I hope you subscribe, listen in every Tuesday, and share this episode and podcast so that others can get healing for themselves.